Great. Well, thank you for the opportunity for us to discuss our journey to an equal merger between Bellin Health and Gundersen Health System. So for those of you who might not know about Gundersen, it was founded in 1892 by Dr. Adolf Gundersen in La Crosse, Wisconsin. And we currently practice and operate in 3 states, 22 counties, and we have about 70 clinics that are locally located in order to take care of patients as close to home as possible. And we also have 6 local critical access hospitals to provide that care as well. So our journey for merger, and to consider that, actually began with a personal pivot point for me as the CEO of Gundersen Health System. Gundersen valued its independence just like every institution, and we valued our ability to control our care. We really believed in our integrated model of care and the physician-led legacy of our system. You see, I was out talking to other local independent critical access hospitals, knowing in my soul that they were better able to survive and serve their communities if they were to become part of our system. But they were resolute in wanting to stay independent, despite the risks of the future. This didn't make a whole lot of sense to me. But this is where I had my epiphany, or my personal pivot point. I realized that Gundersen was much the same. We were thinking along those same lines. We wanted to remain independent as well, despite the risks that we might face. So I asked the question, why weren't we exploring partners to ensure our success going forward? You see, if we were going to be true to our mission of improving the health and well-being of the communities that we serve, we had a duty. We had a duty to constantly evaluate our sustainability for the coming decades and do everything we could to improve the probability that we would remain strong and present for all those who relied on us for care. So our board and our leadership decided that our probability of success, while likely if we remained independent, was actually more likely with an aligned, like-minded partner. But that partner had to also align and share our mission and our commitment to community. Because if we traded our independence for our survival, but we lost the soul of our mission, that would be a pretty terrible trade-off. Even with a great partner, we were going to find trading our independence for the service of our mission still pretty difficult. So we asked the question, what if? What if we actually combined and joined our strengths and our mission with a like-minded partner? What if we did that? We came to the conclusion that our patients, our communities, and our dedicated staff would benefit greatly for decades to come from such a merger. This was the pivot point for our organization as we looked at how we would view our future. So off we went, looking for that partner. And that search led us to the amazing caregivers and innovative leaders at Bellin.
So like Scott and like the Gundersen system, myself and the Bellin system were in much the same place. Like Gundersen, Bellin was founded by a physician, Dr. Julius Bellin. Like Gundersen, we have over 100 years of independence and community connectedness and listening in our communities and meeting the needs of our communities, making our decisions locally with boards of directors that are made up of people from this region. And so 5 years ago, when I had the privilege to become the CEO of Bellin Health, I inherited that legacy, and I felt a very immense responsibility to honor that legacy, to honor that independence and that nimbleness and the relationship that we had with community and with this region. And I also inherited a different time in healthcare. Shortly after, we had the pandemic. We now face all of the headwinds that many of you in business also face. We have workforce issues. We have reimbursement issues in healthcare. There's just a lot that is changing. We have new entrants into the market. It's a very, very volatile market in many ways, and we have the need for significant technology adoption in order to make healthcare more accessible and more affordable for everyone. And all of those things take significant resources, both talent and treasure. And so facing those, we started to think about, how are we going to do this? We can't do it alone. About 70% of health and well-being comes from social determinants of health. So we needed partners, and we knew that. And so we started talking internally as a leadership team about what kind of partners and what would it look like. And we had partnerships. We had a partnership with a group of other healthcare organizations, including Gundersen, where we had this great opportunity to get to know each other and to learn about each other. And they were so similar. Their mission, their vision, their focus on community, and the example about the critical access hospitals and seeing that organization partner with those 6 critical access hospitals and not take away from them, but rather support them and honor that local care should be provided locally when possible, and really strengthening them and helping them, gave us a sense of confidence that they would be a good partner. Now, I still had all of those reservations, right? What is everybody going to say? What are they going to think? New leader, is she giving up? Is she, trading all this in? What's really happening? And we had a lot of conversations internally with our board of directors. What was the community going to think? How do we present this partnership? How do we create it in a way that preserves that legacy and gives us this sense of a future with another 100 years of great care and local commitment? And so we started that question of what if also. What if we partnered in some way, depending upon what that is, with Gundersen Health System, who is so much like us and feels so comfortable to us? Could we create something better than we can create alone? And that started us on our pivot point of going from this sense of independence to partnership. We faced that pivotal question. Are we going to hold on to our pride and stay independent for the sake of independence and that legacy? Or are we going to achieve a higher level of success and a probability of success by partnering with Gundersen? And we chose to pursue the path of partnership, and that exploration began.
It was a great journey for us to go through that part. And after we found each other and we realized that we had a shared mission, I think it was kind of natural to explore, a merged future together. But it's interesting, as we looked at that, mergers are strange animals. They have these traditional rules about acquisition and takeovers and consolidation of services in communities, and actually sometimes even increase the cost to community.
Strange animals is a great way to put it, because in fact, many times partnerships can be called mergers, but when you look at it, it's an acquisition. And that was exactly what we didn't want, because we wanted to maintain that local control and influence. And we wanted to make sure that we weren't sacrificing this region for another region, but rather together we were becoming stronger together. And so that idea that a merger is a merger is a merger kept coming up to us, because consultants and others would, they'd tell us that, you have to do it this way. No, you can't, that's not going to work. This merger of equals, there's no such thing. Well, they were wrong. Together, we engineered what I think is a beautiful merger of equals. And we did it with how we structured our governance. Equal governance, we structured it so that there is a very high level of local control and authority to continue to meet the needs of the people that we serve. We did it by even looking at titling. How can we keep the 2 CEOs of those systems in this new entity with leadership among both, and dispense with the pride and the ego and just make it work for the interest of the people that we serve in these regions that we both are a part of and are so committed to. And while people said it can't happen, I think we've proved them wrong, and we're on the beginning of our journey, but it's off to a really good start.
I agree. Actually, the more we learned about each other, the clearer the wisdom of that equality actually became. We kind of explain each other as siblings. We're not identical twins, though. But we come from the same committed family as organizations because we believe in the communities that we serve. And that's a super strong part of our soul and how we are becoming successful working together. So it really made zero sense, to be honest with you, to consider one party or the other as subordinate, because we were working together to create that new innovative healthcare system of the future. We wanted it to become actually stronger than the sum of all its parts.
And I think that really started our journey on how are we going to integrate, because the integration also has to look that way. It has to be an integration of equals. So we created a great plan. We have 17 functional teams that cross the enterprise, working together, accomplishing things every day. And it's been just a joy to watch. It's been just beautifully executed by the teams. And I think it's because they really do feel this sense of family. And we started early by anchoring ourselves with purpose, the why, and a mission and a vision that is shared. So going from these two systems with our own mission statement and vision statements that were quite similar to one system with one vision of where we were going. And so the teams have this North Star of where they need to direct and go. And back to the strange animals, again, it gets uncomfortable. You face really difficult, challenging decisions. There is a give and a take in any kind of a partnership, even in a merger of equals. We can't always have everything that we want in our region and at the sacrifice of the other region. So it's this constant coming together, but if you have your North Star, if you have that vision of where you're going and why you're doing it, it really does help to resolve. And that question of what if really helps us to get over those hard things. Because what if we do this? What if we do that? But what if we do something even better? And can we transform what we're doing and bring our teams together and find that better place for both of us to be? And that has been a great journey for us, and I think a really successful integration so far.
I think that, of course, there's difficulties, and we have conversations, but we stay committed to that North Star, right? I think by focusing on the good that we can do together and the duty to continue our commitment to our communities, that's made us find that path to success, and also our ability to continue to improve and continue to be present and sustainable for the people who we serve for the next century, right? So we will continue to ask that question because about what if, because we started with our dedication to our mission. We grew into that innovative question of what if, and it's served us well. So we will continue to ask that question as we move forward, because there's going to be uncertainty, there's going to be challenges, but if we keep working together toward that North Star, we're going to be able to deliver on our promise of care for everyone that we serve.
That's a great point. And I just feel like as we continue to face disruption, it's inevitable, it's coming every single day, but we stay focused on our purpose and our mission. I have no doubt that we will see the people in our region will be healthier and achieving their full potential.
And our communities are going to be thriving as a result. Thank you.
Thank you.